Hi, everybody. We're starting our new video. I'm super excited about this one. I want to introduce Lieutenant Colonel Pepper. He's an occupational medicine flight commander, also a board certified in preventative maintenance, occupational medicine, and has a master's in public health. So, Dr. Pepper, we have a couple of questions for you, and these have been kind of echoed across the complex.
Okay.
So, really appreciate your joining us to be able to answer these. And I'll start with the first one. A large number of our complex workforce handles parts, materials, and tools. Can COVID 19 or the coronavirus be transferred by handling these materials?
The simple answer is yes on that. The virus can be transferred between these materials. I think the real question is, can it be infectious when it's transferred? And if you pick up a coronavirus from a tool, for instance, and then you then touch a mucous membrane, whether that be your mouth, your nose, or your eyes, then the potential is there that you can get the COVID-19 disease from that. The research right now shows that there hasn't been any transfer like that. All the transfer has been from person to person with that close contact. But we're so early into this disease. That question is still out there, which highlights the importance of personal hygiene, the social distancing, and cleaning your areas and keeping them as virus free as we can.
Yeah, thank you. Any time length on how long the virus would live?
Yeah, so the current there's it varies. There's 3 to 13 days people believe it lives on a surface. I think the strongest research says about 9 days. What we don't know is how long is that viral particle infectious when it's on a surface. Most viruses start to degrade while they're on a surface and they become non-infectious. That piece we really don't know yet, but I think the answer is about 9 days.
Okay.
It can last on a surface.
Okay, great. Thank you. OSHA has a worker's right to refuse dangerous work policy. Can you elaborate how this policy relates to COVID 19? And can employees request an inspection of their work area if they think it might be contaminated?
Yeah, so looking at this OSHA workers' right policy, there's kind of four pieces to this, and you kind of have to meet all four pieces. The first piece is that you have to ask your employer to get rid of the hazard that could be potentially life-threatening or dangerous to you, and the employer has to not get rid of that hazard from the work area. Another piece of that is there has to be imminent danger to your health, to imminent danger of injury or serious death or injury. The the imminent danger, that's kind of a legal term, and I'm not JA and I'm not acting like I'm G, but when you look up what imminent danger is in the legal world, they give examples of like the mining industry. If a mine shaft is coming down and your boss tells you to go in and finish your job, that's kind of where they give an example of imminent danger. And then another piece, the last two criteria for that is another person has to agree that is reasonable, that's imminent danger, and there has to be a timeline that nothing can be done by your employer to get rid of that danger. I think as far as the complex goes, and then you could speak more on this, we have given a lot of time and energy in putting into keeping people safe on base, keeping the virus out of base, and when it does come on base or in a work area, we're developing procedures and checklists to remove people from that work area, cordon off that area, and clean that area to really get rid of the virus.
Mm-hmm. Thanks. Thank you very much. What's the guidance criteria and availability now of COVID 19 tests, particularly in our area?
Right. So we follow CDC guidelines, both the OCMed clinic, the Med Group clinic here on base, and the state and local county health departments. And that criteria is based off of your symptoms, your contacts, and your travel. And you get a risk categorization of high, medium, and low. Right now, because of test availability, they're only testing people with high, who have that risk category of high, and that's just because of the testing and the reagents that they have for the testing. I think as the days go on, the testing they'll expand it. I know they're talking about doing some testing at Walmarts and Targets, and there's some mail-in testing that could be happening, along with there's a 72-hour testing. As that testing expands, then they'll start testing the medium to low risk people.
Mm-hmm.
And I see that happening here in the next week or so.
Okay, great. Thanks.
Yeah.
Someone asked, can you get COVID-19 twice or more than once?
You can potentially you can get it more than once. A lot of bacteria and viruses you can get reinfected with it. When you get infected with the virus, you develop an immunity to it. And that immunity can vary from person to person and from substance to substance. So bacteria and viruses, they give you different levels of immunity. The immunity can last anywhere from a month to a decade. This one, we're not really sure how long our immunity lasts. If you look at other coronaviruses like the common cold or SARS, that immunity is lasting about 1 to 2 years. So they're thinking that this immunity will last that long. But even with that, some people might have lower levels of immunity. They could get reinfected. Usually that infection it doesn't last as long and it's not as severe. But there again, if somebody gets reinfected and say they're infected, they get removed from the work area, they get tested, they are now healthy to come back to work. They come back to work and they start having symptoms again, then they would go back through the process. We would rescreen them. They would be re-quarantined and retested.
Okay, great. Thank you. And one last question, Dr. Pepper. Is there anything we as a workforce can do to help our local doctors and nurses as we go through this crisis?
I think the best thing, we want to try and avoid what's happened in China and Italy, the overwhelming amount of patients that the healthcare had to deal with. And I think the most important part of that is the social distancing and the hygiene to try and prevent the spread of the disease that will overwhelm our hospitals. I think another piece to that is trying to conserve PPE, masks, alcohol gels, stuff like that, so it's available for people who really need it. Another thing is be a good neighbor. You know, if you have a healthcare worker that lives in your neighborhood, reach out to them, see if you can help them anyway, because healthcare workers are working long hours trying to deal with this. And lastly, another thing that hasn't been highlighted very well is blood donations. Blood donations have gone way down, and it's becoming a serious shortage. So, and they have certified, several organizations have certified that it's a safe and virus-free area to go and get blood.
Great.
So I would recommend giving blood.
Yeah. So Dr. Pepper mentioned all the healthcare providers that have been really working hard around the clock. Our ACMED team here at Hill Air Force Base is absolutely incredible. They have also been working around the clock to first and foremost take care of our airmen and make sure our military and our civilian airmen are safe when they're in the workplace, and that we have the right tools to be able to continue to do our job at the same time, just staying safe. So Dr. Pepper, for you and your team, we have a big appreciation from the Air Logistics Complex. So thank you so much for what you're doing.
We're here to help you.
All right.
All right, and now we're over to our software engineering group for the next video.